all these reactions to food that your MDs know nothing about how to deal with that are, in fact, related to the consumption of food. So many people are going around with reactions to food, and it's not always the typical type of reactions. And let's define what a food reaction is, because there's big, debate or denial in the medical community about what really are reactions that are related with food. For definition purposes, a lot of doctors, and this is your allergist, primary care doctor, and your GI doctor, will think that if you have a food reaction, it is something that's related with your gut only. We call it GI symptoms, gut
Mhm.
gastrointestinal symptoms only. And another group of people will look at it and say it's only allergic type symptoms only. So your allergist will look at it and be like, oh, this person eats food, and they'll have like their throat swells up, their lip swells up, they get hives and they get itchy. So food reaction gets into two groups. There's the allergist and allergy type symptom group. And then there's people in the GI group, gut symptoms only group, where you eat it, you get gas, bloating, pain, diarrhea, or constipation. So these, I would say, are two groups that would be considered food reactions. And so, just so you know, those would be what your MD would see. That being said, how many of you guys have tons of other reactions to food? Type in chat, and Anne's going to check out what some of these are.
Well, yeah.
Um,
This person
yeah,
said, obviously Jill has some sort of reaction, but the testing showed nothing. She knows she's lactose intolerant, but there's probably a lot more going on. Joellen
right.
saying she deals with bloating and sugar cravings.
Yeah. And so the thing is that as I can already tell you, there's already some groupings of different types of reactions, but they're all reaction to food. And a lot of times when you're the patient and you're the person experiencing it, or your child is experiencing it, you don't know who to see. And if you go to the allergist, you're going to get some testing done, what I call IgE anaphylactic, E like emergency, big reaction type of testing, right? So that
Can't
would be
miss it. That's a reaction you will
either
notice.
yeah, it's like if you had an IgE emergency anaphylactic reaction, I
Yeah.
know, you've seen in your kids. I mean, it's like you cannot miss it or dispute it, and that's what most people go to allergists to check for. And the allergist, through their skin tests and blood tests, will only be checking for IgE antibodies. Antibodies is your immune system's response to an allergen or a germ.
Well, and I have
So
a question for you about that, Dr. Maggie, because so many people think, okay, food reactions, why can't I just visit either my allergist or my GI doctor
yeah,
and they're going to test for the reactions and I'm going to have my answers?
yeah, and how many people have seen an allergist and had Chai gone that route and got the answers and solved all their food reactions type in chat? And I'm really interested because I haven't met one person where that was the be all end all answer. And the reason is most reactions to food that you guys are experiencing really are not anaphylactic, immediate, emergent C type reactions. Hi, I'm Maggie Yu, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power pack 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. I went through the 2 buckets that we go see our medical doctors for. I talked about the almost like irritable bowel, like bloating, pain, diarrhea, constipation reactions. That's one group. And then the other group is the allergy type reaction with rash, hives, swelling, right? But there's a third group of reactions that's really big, debilitating, and nebulous. So, how many of you have chronic pain?
Hmm.
How many of you have neuropathy, like pain in your nerves? How many of you have autoimmune disease? How many of you have insomnia, anxiety, depression, brain fog, right? And then how many of you are dealing with like weird diagnosis that people don't seem to know any solution for, like fibromyalgia or POTS, which is postural orthostatic tachycardia? And then a lot of people then are also dealing with the extreme of the allergy component, which would be like mast cell activation, histamine intolerance. So there's all these reactions to food that your MDs know nothing about how to deal with that are in fact related to the consumption of food, but they're not easily diagnosable or treatable in the GI doctor's office or the allergist's office.
Well, I heard you say something that a lot of doctors don't connect the dots on, and maybe some people aren't even connecting the dots on when you're talking about pain. You don't typically think of pain being a
Yeah,
food reaction, but you're telling us it absolutely is, and all of these other symptoms as well, like brain fog and things that you
yeah,
don't typically associate with the digestive system,
yeah.
because the food reactions can infect your whole body.
Well, I mean, I'll give you an example. Janet, prior to getting her food mapping done with us, had this just recurrent left lower flank pain. That's like right below the kidneys on the lower back, right? And a lot of us have these kinds of pains, and we just think, oh, that's normal or that's aging. You go to the doctor, x rays, MRIs, all of it's negative, start to think you're kind of cuckoo, and this is just the way it is. Well, she discovered that she had a problem with sesame seeds and stopped sesame seeds as a result of food mapping. And within 3 weeks, that pain was gone. And to add confirmation data, she tried to put it back about 3 months later. Boom, that side pain came right back. So there's data that's coming from your body along with the data that we're providing in our system that correlates. And when, if she was ever reintroduced, boom, that pain would come right back. So there's multiple different types of data that's in the food mapping system that's important. And we haven't even gotten into testing yet, but that's a clear example where someone's pain that no one could diagnose was directly related with a reaction to a food.
Okay. And I mean, and when you can see that turnaround happen in a matter of weeks, some people I've even interviewed that have gone through your program, they have a turnaround in like a week or in a couple of days after
Yeah,
removing a trigger food that they
yeah,
thought was okay. So it's
yeah.
really fascinating, and that's something that I think people don't necessarily realize, that is a part of your system is you get the data from your own body. You do listen to people and what they say, it matters. So often you go to a doctor and you're not really feeling validated or you're being heard because they're going by just strictly what's going on the test. What are the test results? Well, your body's data is also a big part of that.
Don't take it from me, take it from other people who've actually, we've worked with thousands of people on their food mapping. And so I would love people to share what some of their biggest ahas were.
Here, Dr. Maggie. My low back ached after eliminating food sensitivities that this is an alumni, after eliminating the food sensitivities that you told her about, pain was gone. I'd seen an orthopedic surgeon and was willing to do anything. So willing to go into surgery, but
Yeah.
instead saw you and eliminating the trigger foods that you identified, the pain resolved.
Boom, right there, another case. And there are hundreds of cases like this. You know, literally every month, every other month, there are hundreds of cases like this where these symptoms that are really vague, that no one else can diagnose, boom, it's related to food. To learn more about the food mapping system and my food mapping masterclass, click the link above or below this video.